always do it in years past, but it was very, very nice. The weather was perfect. And I assume because of who you are, that everybody followed the guidelines. Wherever you went, you had on your mask and you were distanced, and you let other people know that that's what we all needed to do. So thank you. Of course, I'm Bernie Anthony. The other members of our team are here. Iris Taylor, Alethea Carr, Lisa Braddocks, and I'm sure you all know Devin from all the emails that you get. Is Roger with us this morning from GDAC?
Yes, I am. Good morning.
Oh, good morning, Roger. So again, welcome. This meeting is really packed with a lot of good information. In your mailing packet that you got before the meeting, you should have gotten some slides, but I think they were updated this morning by Devin with some data on there highlighting the disparities data. We didn't want to spend a lot of time just talking about data. We want to talk more about what's being done and the issues and challenges we have. So you should have the most up-to-date data that we could get from the City of Detroit website and from the State of Michigan website. And it's very, very obvious there are, disparities between African Americans and also Hispanic Americans, but largely African Americans, very prevalent here in Detroit and other places around the country. I think you have to be in a cave not to know that. You should also have a copy of the letter that we sent to the state's equity task force. As you may recall from our last meeting, we didn't send the minutes out of the last meeting, did we, Devin? No. Okay, from our last meeting, we had some excellent discussion along with some recommendations, issues, and concerns. And we followed that up by sending a letter to the State of Michigan Equity Task Force, which they did receive. Renee Canady, who's a member of that task force, is one of our presenters this morning, so we'll be getting a little feedback on that. But I will add that I believe MDHHS has been very aggressive in getting out updates and information. So, so we want to go ahead and start. I just want to say, in addition, just to highlight that we do have Renee Canady, who's the CEO of MPHI, but also a member of the Equity Task Force, and Denise Fair. And Denise is the Director, Health Officer for the City of Detroit. And as you know, the City of Detroit was the epicenter, maybe still is, for the state. So a lot of work has gone on there. So Denise will bring us up to date on that. But is anything else I need to mention? Anybody else on the team? Are we ready to go?
Ready to go.
All right, Dawn, are you there?
Yes, I am, but I think we're turning it over to Iris next, right, for the environmental scan survey?
Yes.
No, you're first, Dawn.
Iris before update?
Iris is first.
Okay, I thought Iris was second. Okay, Iris, an update on the, the environmental scan. We've talked about that at several meetings, and we gotta get some work done. And in spite of COVID, we still have to get some work done. So, Iris Taylor.
Good morning, everyone. This is a follow-up from a couple of meetings ago, actually. As you know, one of the objectives of SEMPQIC for this year is in support of the Mother-Infant Health Equity Improvement Plan. And that plan has 6 key elements in it: health equity, healthy girls and women and mothers, optimal births, spacing and intended pregnancies, full-term healthy weight babies, infant safety and sleeping, and mental emotional and behavioral well-being. So in each of those 6 categories, our partners have been asked in the community to give suggested activities that they could do to support that. And in the plan, the state says we're obligated to do this, and we ask that the partners consider doing X, Y, and Z. And they have elements listed under each of the 6 elements. So what we did to begin with was an environmental scan. We took the actual plan and distributed to the members of SEMPQIC, of which we asked under the actions under each of the 6 elements, do you do this? Are you planning on implementing this activity? Would you like to do this? Or no, this is not applicable. So of that, we had, go to the next slide. Of that, here's the breakdown of the individuals who responded. We had a total of 27 organizations that replied to the survey, and they were in the categories that's listed on this slide. Okay, go to the next slide. So under each of the areas, what we did is we took a look at what percentage of the 27 that responded said that this is an area that we're either planning on implementing or would like to consider implementing, so that we could determine some opportunities to prioritize how SEMPQIC could, across the span of our organizations, implement aspects of this improvement plan. So the results of that scan are listed as follows. There were 4 categories in total for which out of the 27 that responded, gave priorities for. Under health equity, under that particular objective, 44% of the 27 said that they would like to assess and improve how traditional health institutes could use an equity lens in their policy and procedures. 42% of the 27 under full-term healthy weight babies would like to provide grief support groups to families that have experienced loss of an infant. And then 40% of the 27 under optimal birth spacing would like to disseminate information across social media on the importance of reproductive planning. And then finally, at 33% of the 27, under the health equity lens as well, they would like to look at access to assess unconscious bias in providers who serve families and implement strategies to address it. So of those 4 priorities, opportunities that were identified from the environmental scan, what we would like to do at SEMPQIC in our June meeting is identify which of the 4 priorities, or all 4 if the membership desires, we might look at collectively supporting strategies to implement. And that would be our response to supporting overall implementation of the Mother-Infant Health Equity and Improvement Plan. So that's the status of the environmental scan. We'll have that discussion at our June meeting in terms of weighing in on those priorities. So today, because the agenda is so full, our intent was just to give you the response of the survey and to allow you to see where the opportunities lie that the membership has expressed, and then move forward in a full discussion where we can prioritize those things at the June meeting.
Any questions for Iris? No?
Good.
Okay, thank you. So we'll be really digging into this more at the June meeting. Thanks a lot, Iris. Moving on now, Dawn from MDHHS. Dawn, you want to give us an update?
Yes, absolutely. Thank you, Vern, and welcome everyone to today's meeting. It's great to see that there are over 50 people that have joined us to participate in this SEMPQIC meeting. I just wanted to share a few highlights and share some resources as well. So as you are all aware, I'm assuming, that our Safer at Home order has been extended until June 12th in the state of Michigan, with a variety of caveats to that as far as particular sectors and areas of the state opening regarding primarily employment and such. Also, I just wanted to point out that we are monitoring the state of emergency as a result of the dams that have broken and the flooding that occurred in Aranac, Gladwin, Saginaw, and Midland counties. And just wanted to point out the monitoring regarding COVID-19 related to that. As you're probably aware, many families have been displaced and are residing in temporary shelter locations such as school gymnasiums and other large venues. And that's a particular concern, even with social distancing and masking that's occurring, and particularly for those who are most vulnerable, including the elderly that have been displaced as a result. Next, I wanted to share that new maternal infant health COVID-19 materials for pregnant, breastfeeding, and new parents who are parenting newborns can be found on our website, which is michigan.gov/MIHEIP. And those materials were also sent out to each of the collaboratives, so you should be receiving those as well in your email box. Next, I wanted to share that the Maternal Infant Health Summit, you all recall that it was originally scheduled for March, postponed until June due to COVID-19, and now it's been rescheduled for the final time. And it will be occurring as a virtual conference on September 22nd and 23rd. Important to note, though, that you can either join the conference live during those dates, or you can watch the conference for up to a year afterward, and then CEs will be offered for all of the sessions that are CE applicable through the end of the year, so through December of 2020. What's great about this this type of platform, given the current circumstances, is it allows all of us with busy schedules to be able to view more of the sessions and receive the important information that's being shared by the presenters as your schedule permits. So if you'd like more information about the summit, if you haven't already registered and or would like to review the agenda, please go to mihealthsummit.com. So michiganhealthsummit.com, or if you want to think of it as maternal infant health without the double H, summit.com. You can see that information there. Next, I wanted, there isn't a bullet, but I want to point this out that you will be receiving information from your SEMPQIC partners regarding an updated AAP guidelines or statement regarding caring for infants in the midst of the pandemic, and it also includes an FAQ. This was a topic, several of these areas were topics of discussion during our last SEMPQIC meeting, as well as on birthing hospital calls that we're having weekly with all the birthing hospitals in Michigan. So topics such as precautions that should be taken for mom at the time of delivery, delayed cord clamping practices, rooming in, breastfeeding, testing for babies, and just a host of things. Preparing mom, baby, and family for discharge after delivery are covered both in the AAP statement as well as in the FAQ. And again, that will be sent to all of the SEMPQIC members so that you can review that. Next, which is a bulleted item, our Mother Infant Health and Equity Collaborative meeting was held last week, and I just want to point out that it was amazing. There was over 130 people that represented organizations, communities throughout the state of Michigan, and the topic of discussion for the meeting was COVID-19, including the inequities that we've experienced as a state and a nation regarding COVID-19. So if you were unable to participate and or you want to review the slides, there was great information that was shared by hospitals, community-based organizations, local health departments. That slide deck will be posted on our website today, as well as the meeting was recorded. So again, our website is michigan.gov/MIHEIP. MIHEIP. And I would strongly encourage you to view that meeting if you're able to, and review the slides, because as I said, there are a lot of, in the midst of challenge, we're seeing great innovation and successes occurring throughout the state. And those were highlighted last week. Lastly, the Michigan AIMS, or Alliance for Innovation in Maternal Health. I wanted to share that in addition to the hypertension and hemorrhage bundles that are currently being implemented by Michigan's 80 birthing hospitals, a third bundle is being added this year, and that's the sepsis bundle. And that's based on cause of death regarding sepsis or infection in mothers, and the importance of addressing that in the state of Michigan. So I wanted to share that as well. And then finally, so I said this was my final point, but one final point before we move into the next slides. I know you all received the data that Vern mentioned, but I just want to point out that our Region 10, so Wayne, Oakland, and Macomb, 63% of the COVID-19 cases have occurred in Region 10, so in our SEMPQIC area, and 78% of the deaths. So as all of you, you know, who reside in Region 10 and work closely with our partners in Region 10, there's a substantial amount of grief and recovery that's going to have to happen over the, it's going to be years probably to recover from this. But I just wanted to point that out as we move into the next presentation regarding the gravity of the loss that's occurred. So with that, are there any questions for me? And you can chat those in the chat box. I'll take a peek. See if anybody's chatted anything in, and or unmute yourself and ask a question, or if you'd like, you can email me as well too.
I do have a question, Dawn, just to kick it
Sure.
off. Do you guys have a feel now, and I know all the numbers aren't in, for how things went over the holiday weekend? You know, was there really a spike?
I think we won't know that, Vern, until probably 2 to 3 weeks out. So the incubation period is 14 days. And then after that, of individuals that as they become symptomatic or are concerned, then there's the lag for testing. So I think it's probably going to be a 2 to 3 week lag.
Wow.
And I'll point out just as examples, you know, a lot of folks travel to Northern Michigan. Coming back from Northern Michigan, from the Upper Peninsula, there was a traffic backup. I heard from almost an hour from cars trying to get back through the bridge that went up north. And then, you know, there's obviously, as you pointed out, Vern, we're very hopeful that social distancing and masking occurred, but also are aware that it may not have occurred in every instance. So we'll have to see, as well as what the decrease in restrictions may or may not have resulted in. So hopefully we continue to move forward in this downward trend. But as you've heard Dr. Khaldun and our governor say, time will tell.
Okay, do I see a question there?
I have a question, if I might.
Who's talking?
This is Cynthia Tagg from
Oh.
Ascension, Southeast Michigan. I was wondering if you mentioned that your meeting last week was an excellent one. Do you post the proceeds or the minutes from the meetings someplace that we can review them?
Yes, well, so the slides as well as the recording will be posted, and they'll be posted. I chatted in the chat box now because I had another similar question, but they're at michigan.gov/MIHEIP, as well as I'm certain that your SEMPQIC partners will share the link to the recording and the slides as well too. I see Devin shaking her head. So absolutely.
Thank you.
You're welcome. And I see my email's been requested, so I'm going to put that in the chat box too. And those of you who know me know that I'm extremely responsive. So you'll get a response back very quickly if you email me. And again, it's in the chat box, but for those of you on the phone, it's Shanafelt D. So SHANAFELTD www.michigan.gov. We have a question from Dr. Kaysensori regarding the zip codes for Region 10. I can't say the specific zip codes because there's so many, but I will say that it's Wayne, Oakland, and Macomb counties that make up Region 10.
And we do have maps with zip codes on it. We could pull that up and put that on our website if people are interested.
Okay, I don't see any other questions, but I'll continue to watch the chat box and answer those and also watch my emails. So again, thank you everyone. I appreciate the opportunity to share updates with you all.
Okay, thank you, Dawn. Moving on to really the update as to what's really happening on the ground. Denise Fair, we want to welcome Denise. Welcome her. I think this is her first SEMPQIC meeting, but also welcome her as, I'm putting this in quotes, new public health director for the city of Detroit that really had to come into that position and just jump right in the fire. And I do want to compliment you, Denise, for picking that up and just running with it. So we're very proud, of the city, the work that you've done, and the mayor, and really pinning down what needs to happen. The work with the nursing homes, for example, some of that is really outstanding work. So Denise, are you there? You mean after that great introduction? What time is it? 10:28. I guess Renee Canady?
Yes, yes.
No, Robert. What did you say? We will start with Renee. Okay, Renee is the executive director of the Michigan Public Health Institute, as well as a member of the State Committee on Equity. Thanks, Renee. You're on.
Hi, Vern. Thanks so much for inviting me. It's good to see so many familiar names in the chat. And Dawn, as always, appreciate your leadership. I just want to chat a little bit about what I'm seeing from my vantage point. And, sometimes I start sort of health promotion prevention talks, reminding people of that 4x4 model that we used to have in the past administration around how do you stay healthy, you exercise, you get your sleep, you see your doctor, all of these things that we customarily know, and what we need to do to stay healthy looks a little bit different now in the era of COVID. So Vern, thank you for underscoring the importance of us. This is one case where taking personal responsibility is an important gesture. And the state task force has been particularly driven by what are the sort of immediate things we can do to improve assure the safety of citizens of Michigan. And so on the next slide, you'll see that what we've done is set up a couple of task forces. The first one is the infrastructure testing work group, and we're pleased that Brenda Jaggedy from MDHHS Office of Office of Equity and Minority Health is leading that task force, but really trying to look at how do we stand up testing more effectively, and we're going to be announcing a number of testing sites in the Detroit area particularly, but in the past week, and we do meet weekly, and task force, the subcommittees meet, or the work groups meet weekly as well. And so MDHHS is determining vendors to really help expand the testing capacity, meeting with local stakeholders, trying to figure out where should we be locating testing sites based on zip codes, and then confirming who those partners are. And I will say that I also serve on Ingham County's Special Populations Task Force, which is also concerned about the same issue of representation and disparity. And we're doing very, very similar things. The second task force that we have, work group that we have, if we can go to the next slide, is really focused on primary care and how do we make sure once we identify folk with COVID infection that they have access to treatment. And so we've been doing, that work group is led by Dr. Randy Rash, who is Dean of the College of Nursing at Michigan State University. They've been working very closely with Wayne State and different physician groups as well as Ford Motor. And then also looking at, kind of what's the uptake. Once we get people in their testing, and we're hoping to be doing tens of thousands of tests per day, how do we track that? And so they're looking at a patient education platform called Genius to assist in that regard. Also thinking about what is the standardization of the provision of care to make sure docs and providers, clinicians are working from standard protocols. Also looking at what other caregivers like community health workers and volunteers can we use on site to connect with communities so that they feel more confident in the providers and the advice that they're being given. And then lastly, really looking at health plan collaboration. This is going to cost money. How do we pay for things? How do we institutionalize things in a favorable way? And then lastly, and I'm most pleased about this responsibility, is how do we develop a model for use after the crisis has ended? So I really want to challenge you all. Of course, initially, as I mentioned, we were trying to think of what were those sort of quick wins? What was that low-hanging fruit that we could take advantage of to get people out of harm's way? Now that we've been in this for a while, and now that we're moving into the governor's stage reopening strategy, what have we learned that we can now implement continuously? So just to give you, next slide will show you just a couple of things that I would encourage you to be thinking about. Of course, we know, those of us that have been in this work for a while, that there's nothing new about the inequities that we're seeing. But I just wanted to come from a little hopeful place that share this quote, that in order for the light to shine brightly, darkness must be present. And we have had a lot of darkness in COVID. When the lieutenant governor who is leading our task force shares that he has, at that time in March, had 15 people in his immediate circle that have died, family and close friends, that's a pretty dark space. So next slide, I want to just agitate your thinking a little bit. Remember that pregnant women are products of their environment, right? So there's nothing unique about pregnancy and COVID, but if you are living in the United States, in Michigan, in Detroit at this time, then you have to be attentive to those factors. And so I want to commend SEMPQIC for bringing this topic to the front. Next slide, if you would just begin to think about, there are many, many things that affect the lives of women of color in general, and pregnant women in particular. If we think about what educational opportunities, right? Education, we know, leads to employment opportunities that can look very different. If you have an executive, an advanced degree where you're an executive, and as myself, and recognizing that privilege that I have, as opposed to those who have a high school diploma or perhaps less. And so begin thinking about, what are you seeing on the ground, and how can you help inform what that strategy will be post-COVID? Next slide, we know that education certainly is tied to employment, and risk of to COVID really we see associated with many things in the work context. I'm reminded of the fact that just because you have an advanced degree as a woman of color does not mean that you are free of threat of poor pregnancy outcomes or risk to COVID. And so many of you know the study, the seminal study that was demonstrating that college-educated Black women still have a higher likelihood of losing their infant during the first year, up until the first year of birth, than white women who have no high school diploma. And so again, thinking about that context of women's lives as you help advise us around our response to COVID. Next slide. Similarly, we know that social distancing looks very different in many of our homes, right? And the women that we're most concerned about aren't living in beautiful, immaculate homes like the one on the right. They're perhaps in more vulnerable communities like the one on the left. Or in the next slide, I would just agitate you to think about, do they even have a home? What does homelessness look like for the women that we're serving? Sometimes we use this phrase, sofa surfing, and that is what we begin to see as a state of homelessness. So next slide. When I listened to Iris's report, and she says that some of the non-traditional partners, like housing and transportation, are wondering how do they do their work through a health equity lens. I just want to remind you that the cliche almost of saying, let's do this through a health equity lens, really is saying, let's do this thinking about where power and poverty and racism have influenced the populations that we're serving. That's what you're saying when you say, let's look at this through a health equity lens. So all of those trends and patterns, the disproportionate representation of African American in this COVID crisis, that is what structural racism looks like. So last slide, I just want to encourage you again, as with that quote about the darkness and the light, leaders see problems, but they seize opportunities. And that is what they started out our task force, the very first meeting, led by former Representative Tommy Stallworth and our Lieutenant Governor, both of whom are men of color. And they said, we know the problem. We know what's causing the problem. It is the same challenge we faced for generations, but we don't want to dwell on the problem. We see that. We want to take advantage of the opportunity that's posed by this problem. And I believe that we're going to be improving systems and structures for people of color, but it will take more than what we do as a task force. It really will take our partnership with you all. So thank you, Vern, for the opportunity to join you all. And I'm happy, as Dawn said, to take questions in the chat, or I think on my next slide, I think I might have forgot to put my email on that. But Vern can also help share that. Yeah, no email, sorry guys. But please let me know how I can support you in the future.
We know how to find you.
Okay.
Please, folks, if you would type in your question, or if it's quiet, feel free to just speak out and ask your question.
There is a question in the chat box from Dr. Holtrop, and she asks, is there any plan for testing sites for children? Children's Hospital apparently only tests children who are being admitted.
You know what, Dr. Holtrop, that is a great question. The current sites that have been run by the task force, and as I mentioned, those will be announced in sometime this week, do not include children, but I will be sure to raise that point at Friday's meeting. That's an excellent point.
Other questions?
Hello, yes, this is Cheryl Gibson Fountain. Dr. Canady, thank you so very much for, we're really grateful for your participation on the Disparities Task Force and all of the leadership that you've given us across the years. My statement is this, and we've had a really amazing support from the department with regard to our implementation of the AIM bundles. And Dawn alluded to the fact that we're adding sepsis now to the hypertension and hemorrhage bundle. But we all know, as you alluded to, with regard to, you can be a college-educated African American, your risk for having a preterm birth and maternal morbidity is higher than that of an uneducated Caucasian woman. And we know that that has to do with the manner in which African Americans are not listened to when they enter the health arena. So we have been, as a part of the Michigan Maternal Mortality Surveillance Task Force, wanting to and on the road to implementing implicit bias training requirements for any and everybody that takes care of our patients when they enter the healthcare arena, and have been in conversation with our Representative Brenda Lawrence and our Senator Debbie Stabenow to get funding for the infrastructure to implement that. We know that you know, what was described previously was the fact that 78% of the deaths with COVID appear in our Southeast Michigan area. And
Your
Cheryl,
phone
you
went.
cut out.
more importantly, in our in the zip codes that Dr. Kason Sori was alluding to. I know this is I'm alluding to. Can you hear
Cheryl,
me?
your phone, yeah.
We
Go
hear
ahead and
you.
out.
Okay, so what we really need to do is have help with somehow implementing the fact that everyone needs to have this implicit bias training, just as we implemented the opioid ethics, and there was one other, human trafficking. And so that is a part of maintaining licensure for anybody that takes care of people. And we just know that, once again, because of the fact that African Americans aren't listened to, we need to address this point with regard to implicit bias training. And so I was wondering if that was a discussion that you all had, Dr. Canady.
That is not a conversation that the task force has had, but I have heard this coming around in a lot of other circles. What I would encourage, Cheryl, you and SEMPQIC and those that you're partnering with, the task force is candidly looking for policy. I mean, it's a politically appointed governmental entity. They are looking for policies that they can take. And so when you mentioned about licensure or the example with the opioid, that's the type of tangible recommendation that we're looking for.
Okay,
so I'd be happy again to share that. I do believe that sometimes things come with a little more oomph when it comes from constituents. So as you all have this meeting and continue thinking, I would encourage another, even just a follow-up email to the task force. We are abiding by the Open Meetings Acts and access to all of the discussions, and that is a point that I think would be good to be placed on the record in terms of licensure, or how that there are oftentimes what we call unfunded policies.
Yes.
So, but even getting the structure in place, and then we determine what happens in terms of the funding, I think is important. But absolutely, not just clinicians, right, but other folk in the health system as well.
Yes. Well, thank you so very much.
Thank you, Cheryl.
Okay. Yeah, we will definitely take that challenge and follow up on it. So you'll be hearing from us, and may get some more information even today before this meeting is over. I see one person has asked a question about the homeless. So I'm wondering if we can hold that until after Denise speaks, because I think the city is involved in that. But is there anything you want to comment on in relation to that question, Renee?
No, I would do the same thing. I would be deferring that to Denise. That'd be great.
Okay.
One quick question.
Any other questions for Renee?
This is Alethea. Can you hear me okay?
Yes.
Hi, Renee. How are you? Good to hear from you. I was wondering if you could comment on how the letter was received by the task force that came from SEMPQIC. We shared that with the membership as part of the materials for this meeting, and so it might be interesting to hear if there were comments or what was done with it.
Yes, that's actually a great question, Alethea. Thank you. Those letters are sort of kind of read into the minutes, not literally read, but saying, you know, acknowledge that we received this communication. Your letter was also shared particularly with Brenda Jagedy's group that's doing the testing, because you all spoke to some recommendations for testing. So that was considered by the task force. I have received about 2 other letters similar to you all that I share with our leaders. I share with the Lieutenant Governor and with Mr. Stallworth for their advising in terms of which direction we're heading. So it was acknowledged to the entire task force. It was shared with a specific work group, and then it becomes a part of the minutes and the record of the task force proceedings.
Yeah, I will say that many of the recommendations have now been implemented and executed by MDHHS. And one of those recommendations I know was the ability to have visitors or an additional person there. So I don't know if it was the crowding or what, but it was even in an executive order that there could be no visitors, but that's not the case anymore. So many of our recommendations have been responded to.
And of course, you know, it's sort of hard to say, oh, we did this because SEMPQIC wrote us this
Right,
letter.
no, I know.
But I will say the influence was there. The signatures that you had on the letter and the content and substance of the letter were very, very strong. And so I have no doubt that people took it very seriously as they read it and considered their work. So thank you for taking the time to put that together.
Any other questions for Renee? Am I missing any? Okay, all right, thanks, Renee. Hopefully you can hang around for a while.
Yep, thank you.
We really appreciate it, and of course we'll be following up. Okay, now for my great reintroduction of Denise Fair. Denise has joined us. As you know, she's a pretty busy lady these days. And Denise, we want to welcome you to SEMPQIC. I think this is your first meeting, and also welcome you as a health officer for the city of Detroit. We know that you haven't been that long at the city and just really had to jump right into the fire and just start to get things done. And I really want to compliment you for taking on that leadership. And I've noticed that you've been very visible as a spokesperson, you know, on the issues around COVID and the city. And that is very much appreciated. And so with that, Denise, it's on you.
Thank you so much, Vern. And I will say that I'm actually a really shy person. And every time I say that, people are shocked. But as Dr. Canady mentioned, leaders don't just see problems, they seize opportunities. And so for this particular job that started 9 months ago, I didn't really see it as a job. I did see it as an opportunity to make a difference. I'm actually in my dream job, serving the city of Detroit. And it's been a very interesting ride so far. So started in September. And we moved from our old Jefferson building to now at 100 Mac, which is across the street from Whole Foods. And so again, first couple months, pretty smooth. And then all of a sudden, COVID. And so I'm going to share with you today about the COVID experience with the Detroit Health Department. And I'll talk to you all about our communication process, our focus on nursing homes, the expansion of testing, and now an additional topic, which is the homeless population, which I've just added. So in March 10th, that was D-Day for the state of Michigan. We had our first case. Detroit had their first case on March 11th, and literally it's been all hands on deck. And so the role of the public health department is to provide 4 things: communication, education, surveillance, and also emergency preparedness. And as a public health department, we always stay ready, and we were very much prepared. So what we noticed was when we had the first case, the number of cases were pretty slow at first. And then all of a sudden, we were reporting on hundreds of cases every single day. So not just 20 cases, 40 cases, but it was like 150, 200, 300. And so we needed to focus on first communication. So there's over 700,000 residents in the city of Detroit. And multiple generations. And so we had to focus on not just the traditional PSAs or just the press conferences, which has been great, providing daily information from the mayor and also myself and also a few guests. But we focused on using our social media because remember, we were limited. You know, we're in the middle of a pandemic and we can't have large gatherings and large meetings. We can't flyer. So we relied heavily on Facebook, Instagram. I've done a lot of Instagram lives with the younger generation, the Generation Z, millennials. We partnered a lot with the local influencers. So Royce95, Curtis Roach, GMAT Cash, just having those conversations. And we were really keeping it real, stating, you know, COVID is an issue. Young people are not immune to COVID. I've had to share, you know, you may be bored in the house, I get it, but you need to stay there for your own protection. So that's been really helpful. We also tapped into our community allies. So we partnered a lot with our local clergy who was looking to us because they really wanted to hold services in a safe manner. But we were providing them with directions and had a lot of conversations with them, with local schools. We partner with our city council and our Department of Neighborhoods to produce daily educational webinars on what COVID-19 is, not just in English, but in multiple languages, so Bengali, Spanish, etc. So that was really helpful. Also, you know, when you're in the middle of a pandemic, it's really important to provide communication to everyone. And so one way we can do that is through telephone. So we stood up very quickly a 24/7 call center. We were averaging at our peak about 400 to 500 calls per day. And anyone could call just to ask questions about anything related to COVID. And that was really, really helpful. And then finally, we just met people where they were. People were out of work. They were looking for food. They were looking for resources. And so we went to those food distribution centers and passed out educational trigger cards, which I think was also helpful, again, in multiple languages. Now, you can go to the next slide, but I want to focus primarily on the mitigation strategy for our seniors. And so in seniors, they are the backbone of our community. And what we found is that COVID-19 spreads really fast in congregate settings. And so in the city of Detroit, there are 26 nursing homes. And our goal was to test everyone, every nursing home resident, and also some of the staff. We ended up testing about 2,000 residents in 26 facilities in about 10 days. Not only did we test them, and I'll tell you, we partnered with Wayne State University and the medical students, Henry Ford clinicians, and of course our own clinicians at the health department. But we went out to each facility, swabbed them, and took the samples back to the health department where we ran the samples. And we're utilizing something called Abbott. Abbott testing is the rapid test. And it's a simple way to know if you have COVID-19. It takes about 15 minutes or so. So that's what we did for 2,000 residents. Not only do we provide testing, but also education on infection prevention control. And we also delivered PPE, so masks, gloves, hand sanitizer, which is really helpful. And we developed relationships with the nursing directors. So I will tell you that we really do not have a strong relationship with the nursing homes. Most public health departments do not have a strong relationship. So based on our testing and our conversations, I think that's been really helpful. So the infection rate was about 24%, which is really high. And so again, we helped them cohort patients, and we ended up retesting them another time. So after our education and passing out PPEs and our testing, we partnered with the CDC. They came from Atlanta and helped us out for a couple of weeks. And we found that the infection rate decreased drastically. So now the infection rate is anywhere between 5 to 10%. And so we're really proud of the efforts with the health department. Then not only have we done nursing homes, but we've also expanded our efforts to go to long-term care facilities, including adult foster care and group homes. We tested about 36 of those facilities that already had COVID cases, and the infection rate was about 8%. And now we're spending our time on senior apartments. So again, seniors, they're a high risk population. So again, we want to focus on seniors. There are 80 buildings in the city of Detroit that are apartments for seniors, which is about 8,000 residents, and we're going to test all of them. Our goal is to test every senior resident in the next 5 weeks. And so far, I think we've tested about 30 buildings, a little over 2,000 seniors. The infection rate is about 1%, which is extremely low. So again, that was our focus on our seniors. And again, as the slide says, over 65 and older, they're higher risk. And those living in communal settings are greater risk where viruses can spread quickly. Now, that's more of a short-term strategy. We are determining what our long-term strategy is going to be. Obviously, it'll include additional testing. And finally, in my last slide, general testing. So if you can go to the next slide. As I stated earlier, the case and death count was slow at first, and then it rose quickly, I mean, dramatically. It was almost like overnight. There was a point where we lost about 500 of our neighbors in just a matter of a few weeks. And so testing is also really important in a pandemic. So it's communication and also testing. So Mayor Duggan initiated a large kind of drive-through testing at the State Fairgrounds, which I'm sure you've all heard about that. All you would need is a prescription from your doctor and an appointment. But what we found, though, is that a lot of Detroiters did not have access to a doctor. So the health department partnered with about 30 FQHC physicians who were accepting new patients. And all the patient had to do, the resident would just be, to call the health department, and we would connect them with someone who was taking their insurance, or if they didn't have insurance, that was okay as well. So the resident went directly to the doctor, got a prescription if they had symptoms, if they met the requirements, and then they would go directly to the State Fairgrounds and be tested. But we wanted to reduce barriers. So we developed, it was the city of Detroit partnered with a couple of local cab companies to make sure transportation was available. So if you are a resident and you have symptoms and you're going to the doctor and you need an appointment at the State Fairgrounds to be tested, you would just call the call center and say, I need a cab ride. And it was $2. And if you didn't have $2, that's okay, we'd still pick you up. So that's been really helpful. We want to reduce as many barriers as we can. So that's been really important. And then finally, back at the health department, I mentioned the Abbott testing. In the city of Detroit, there's probably 4,000 to 5,000 first responders. And we were finding that police officers, especially, they were being exposed. And at one point we had over 500 police officers in quarantine. And so those are our first responders, and we can't have them just in quarantine. We really need them back out serving our community. So we stood up the Rapid Clinic COVID testing site at the health department for all of the first responders. And so to date, we've tested over 2,500 first responders. They were able to get their test results really quickly. And then if they, of course, were positive, they would quarantine. But if not, they would get back to work. And it's been really, really helpful in reducing the spread. So we have a long way to go. I think we're headed in the right direction. I think we focused a lot on vulnerable communities, especially our homeless population. And I like to say people who are homeless, not just the homeless population, but those who are homeless. There are 24 homeless shelters in the city. And so we developed a process whereby nurses would go to each of the 24 homeless shelters 3 times a week and take their temperatures. If it was a high temperature, like over 100.4 degrees, they would be transported directly to our quarantine site just for those who are homeless. And that's been really, really helpful. We have 2 homeless shelters, one at the Salvation Army, one at Mary Grove College, which is like an old dormitory, and it's been really helpful. In the last 8 weeks, we've conducted over 25,000 temperature checks. Again, it's been really helpful. So that's what we're doing with our homeless population. Again, we have a long way to go. I think what's been really important is that the trend is heading downward. And we've received a lot of national attention just in the last couple of weeks because no other city in the country has had such a sharp decline so quickly. And I think it's because Detroiters have really stepped up. They're wearing masks, they're practicing social distancing, they're staying at home. And that is the reason why we are experiencing what we're experiencing. So that is my presentation, and I'd be open to having continued dialogue. I can answer any questions.
Well, yeah, we do have a few questions. People are putting them in the chat box here online. One question that was asked of Renee that you may be able to answer is about testing for children. Is that available anywhere other than Children's Hospital?
Oh, yeah. So at the state fairgrounds, we test children. The cutoff is 6 years old. So if you are 6 years old and older, then you can be tested at the state fairgrounds. So what I failed to mention is that the original process was you had to be a Detroit resident or be a member of the Tri-County area. So Wayne, Macomb, Oakland. You have to have a prescription. Now Mayor Duggan has made it possible that any Detroiter, you can go and get tested at the state fairgrounds. All you need is an appointment. You don't need a prescription. You don't need symptoms. If you want to get tested, then now you can get tested. So we have reduced every barrier that I can think of. And so it's really important. So children above the age of 6 years old, all the way up to 100 plus, can get tested right at the state fairgrounds.
Okay, thank you. There was another question about the homeless. How can we reach out to members who are homeless without them having any contact information?
So we do have their contact, well, not everyone's contact information, but when they come to the homeless shelter, we ask them questions about their whereabouts, like the last shelter that they have visited. Some of them have IDs on them, so we try to collect as much information as we possibly can. And you know, I think it's hard to gather a lot of information, but we gather what we can.
Okay, Tammy, does that answer your question? Okay, assuming it does. There was another question that says, please expand on the 24% infection rate.
Okay, let's see. So out of the 2,000 residents that we tested, 24% of them tested positive for COVID-19. And so when they test positive, the health department will provide guidance on how to properly isolate those who have COVID, separating them from those who don't. We provide them with education, but the infection rate means that of those 2,000 people, 24% of them were infected with COVID-19. But the great thing is now, after all of those interventions, the infection rate is still there, but it's 5 to 10%, which is a lot lower than what it was.
Are you all able to do a contact tracing and follow up at this point? Is that being done?
Oh yeah, so right now we're doing a lot of contact tracing. It's more of the facility investigations at this point, but because now the number of cases is decreasing pretty rapidly, we're going to focus more on widespread contact tracing, and we're in those kind of strategy right now, working with the state to develop the most appropriate protocol. And actually, what all of you can help me with is delivering this message to your family and friends that contact tracing is going to be coming. And so if you as a resident, if you test positive, just know the health department will call you and will ask you who you have interacted with over the last couple of days. So that call will be coming. That's what we mean by contact tracing. So we're tracing the contacts. And so that's a part of our protocol right now.
Is it possible for a person to kind of be proactive if they have a positive test? To just call the health department so that that process can begin?
Sure. I mean, they can definitely call us, but we'll probably find out at the same time as they find out.
Okay.
Because all of the results are reported directly to the state, and we update our results every day at 2 o'clock. So we always know that it's no problem. They can definitely give us a call. As soon as somebody finds out that they have COVID-19, they need to immediately quarantine. That's really important. So they shouldn't be out and about walking around, even just wearing a mask. They should be at home quarantining for up to 14 days.
Okay. Another question, do we know what the false positive and false negative rate is for the Abbott rapid test?
Yeah, so we conducted, if you go to our website, detroitmi.gov/health, right, if you scroll down to the middle of the page, there's 2 boxes, or there's 3 boxes now, but one is the Abbott verification report. We wanted to make sure that the Abbott machine is actually working. And so we sent 50 samples up to the state lab. and they proved that it was correct. So we sent 50 negative samples, and I believe all except one came back as negative, and one that came back negative because there was not enough samples in the medium. But we are really, really confident and feel really good about the Abbott testing. I think it came back as 95% accurate.
Okay, someone asked about the policy on repeat testing. Judy West.
Sure. I'll need a little bit more context to what she's asking.
Judy, you want to add a little more context to that? Your mic is turned off, I think. Or you can just type it in. Okay, while she is doing that, there was a question about transportation to testing sites, that they've heard that Uber and Lyft drivers are rejecting rides that they know are going to testing sites.
Yeah, so I haven't heard that, but for the state fairgrounds, again, if you need transportation, you would just call the call center, get an appointment, and then tell them, I need transportation, and they will pick you up from your home, take you directly to the state fairgrounds to be tested, and then take you right back to your home. We are not using Uber and Lyft for that. We have a private company that's been assigned.
Oh, so mainly they need to call the number rather than Uber. They don't have to call Uber.
No, they don't.
Or Lyft.
Looking for that phone number. I think it's, I'm not going to try to guess, but there is a number for the call center, and you just call and schedule. So please, and another thing you can help me with, please do not just show up at the testing site, because if you do that, they will reject you. So you have to call and schedule an appointment. We're testing about 2,000 people a day. And so it's really important to get an appointment.
Okay, Judy, Reverend West, Pastor West, came back with her question. If someone has been tested and is negative, under what circumstances would you test them again? Only symptoms or confirmed contact with a positive person?
So I'm not a physician. However, in my professional opinion, if you are in an area where there's active COVID patients, then I'd encourage you to go and get tested. If you have contact with a lot of people at one time, like a close environment, and you were not wearing a mask, maybe your friend wasn't wearing a mask, you should go and get tested, because you could be asymptomatic. And so asymptomatic means that you can be perfectly healthy, show no signs of COVID, but you could be spreading it all over the place. And we just discovered that not too long ago. And that's what we found actually in the nursing homes. I think it was 50% of those who tested positive for COVID didn't have any symptoms at all. And so it's really important. If you are a Detroit resident, you can go and get tested. You can call them today, get in tomorrow.
Oh, okay.
Yeah.
Someone asked if you would repeat the call center number.
So I think I'm gonna do this off of memory. I've done this like 100 times and I still can't remember the number. I believe, and I'll check it.
I'll find it in the chat box.
Okay, yeah, 313-205-0505. And I'm gonna fact check that real quick, or somebody can do that for me. 313-205-0505.
Okay.
Awesome.
We'll put it on our website too.
Great.
Is testing voluntary for nursing homes and senior citizen buildings?
Oh, no, it is mandated. Yeah.
Oh, okay.
And so everyone has been extremely collaborative. We haven't had any pushback. I think people really appreciate the fact that we're testing, and we're not asking the seniors to come directly to us. We're going directly to them. Now with the staff, we're encouraging all nursing home staff to go directly to the state fairgrounds to be tested, because staff are the ones that are going in and out of the nursing homes. And so it's really important for them to be tested.
Okay, let's see if there's another question here. Are employers responsible for reporting positive tests? And is there a form for that? that you're aware of?
So I'm not aware of individual employer responses or their policies and protocols. However, if they are a Detroit resident and they test positive, we're already going to know about it. So let's say, for example, DTE. DTE is based in the city of Detroit. If you have someone who is an employee of DTE, they don't live in the city of Detroit, then we at the health department are not going to know. So we only know about Detroit residents.
So does that mean that people that are tested, when they give their city of residence, that city is always notified or should be?
I think that's definitely important. I don't believe that's been baked into any of our processes yet. And, you know, so one thing to know is in this pandemic, a lot of what we're talking about was developed on the fly, and it had to be, because we're dealing with a pandemic, things are happening all the time. And so our processes haven't been as refined, but it's been working so far. And that's why we're seeing a huge decline. But I'm going to take this back to my team. I think that's an incredible idea.
Okay.
Make sure that we are aware, or if we're not aware, we're still providing resources to those businesses. Now, we have provided a lot of resources to the businesses. We've developed a COVID-19 safe workplace for all businesses. We've given them protocols, which is, they're very simple. It essentially states that when your staff comes back to work, they should feel extremely safe. And they're going to feel safe if you implement regular temperature checks, you have PPE and hand sanitizers, you're practicing workplace distancing. And so we provided them with guidance, especially with our smaller businesses. Right now, if you go to detroitmeansbusiness.org, again, detroitmeansbusiness.org, there's a whole playbook for small businesses, for restaurants. And then also, if you're a small business that has anywhere between 2 to 5 employees, then we're going to give you a PPE starter kit. It's like 100 masks, tons of gloves, and hand sanitizer for you just to get started. So we have done quite a bit for our small businesses. So here's the number. I was correct. Actually, I was not correct. Okay, so the number that you had, just scratch it out. It's 313-230-0505. So again, 313-230-0505. You can call this number anytime between 9 a.m. and 7 p.m. Monday through Sunday. So call today and schedule your appointment.
Yeah, I see it here. 313-230-0505.
Yes.
Okay, there's a COVID hotline, 876-4000.
Yes, so that is the health department phone number. So if you have a question 24/7, give us a call, 313-876-4000. You also can call there to get your results. In the last, I believe, week now, we are emailing results directly to our patients, to residents, which is an upgrade. But yes, 313-876-4000. If you don't want to talk to us, that's okay. We get it. You can send us an email. That email is checked 24/7 as well. That email is dhdOutbreak@detroitmi.gov. Again, dhdOutbreak@detroitmi.gov.
Okay, we'll get all these numbers down, but yeah. So the call center, if you're looking for a test, and the hotline, if you have any questions about pretty much anything COVID. Okay.
Hi, Vern. This is
yes.
Hi, I do want to sneak in a question. I felt that it would be better for me to ask it versus type it in the chat box. So this is Lisa from GDAC, and I'm curious to find out, as we know nationwide, the numbers for African Americans as well as Hispanic Latinx population have been quite alarming. And it doesn't appear, as I'm looking at the data for the Hispanic population here in Michigan, that seems to be the case. And I'm curious to find that out for the city of Detroit, if that's something that is, we need to look into. Numbers are low for a specific reason. Is it because this population is not coming in for testing, or is it just that it's not affecting them as proportionately as it seems to be nationwide? So is there any?
Part of that question, because somebody walked in. I think your question was regarding the Hispanic population in terms of testing? Okay, so it's interesting, Lisa, because I had that same thought. So I look at dashboards all the time. I'm like obsessed with data. It's really a problem. And I look at dashboards all the time. And so I have a really strong epidemiology and communicable disease department, health department. If you go to our website, detroitmi.gov/health, and click on COVID-19 updates, click on the dashboard and click on the zip code analysis. So in the zip codes, you'll find that there is a lot of, the spread is all across the city of Detroit. But in one particular zip code, which is 48209, I believe, which is primarily Hispanic, the number of tests are really low. And I believe there are residents who may have COVID-19, but they're not getting tested. And so again, it's really important to make sure that we're providing communication. So we made sure when we created billboards for everyone. So the digital boards, they're in multiple languages. We made sure we had webinars, not just in English, but in multiple languages. We made sure that we partnered with Chaz Community Clinic, which is now, Chaz just launched their drive-through testing site a couple of weeks ago, which has made it more available for everyone to be tested. But I think there's also, and what we don't talk about is there's a stigma associated with COVID. So if you have COVID-19 or you're getting those symptoms, you don't want to feel, as the young people say, some kind of way, so they don't get tested. And so we're making sure that we have reduced the barriers. We've made transportation available. We're making sure that communication is targeted. And so I think because of those efforts, we're going to see the numbers spike up a little bit. But I don't get concerned when we have over 10,000 cases. I actually think that's a good thing, because I know that we are providing testing for everyone who needs to be tested. And when Mayor Duggan said, anyone can be tested in the city of Detroit, you don't need a doctor's note, you don't need symptoms, again, that reduced another barrier as well. So that's a really great question. And I think we need to continue making sure that we provide targeted approaches.
And then I think that the discussion about maybe perhaps the looming threat of, ICE or, people who perhaps don't have citizenship, those being barriers, the back of their mind thinking that this might be something that they want to avoid because law enforcement may ask too many questions. So thank you for shedding light on that, and I'll definitely take a look at those dashboards.
Thank you, Lisa.
Okay, someone asked, Marcia, is there a COVID hotline number for out Wayne County? Does anybody know? Gaylada Murray asked that question. Does anyone know if there's a COVID hotline for out Wayne County? Or Wayne County Health Department, I guess.
I'm sure there is one. You can visit their website. I'm sure they have one, but if not, again, the Detroit Health Department, you don't have to be a Detroit resident to use our call center. So we're not gonna know. So just call us 313-876-4000, but definitely check the Wayne County Health Department's website as well.
Okay, this has been fantastic, Denise. Just a wealth of much needed information. And we're really pleased that you were able to join us. Somebody just put up the Wayne County Health Department hotline. Thank you, Devin. So that is there.
Hi,
Go ahead.
This is Teresa from Impact Community Health. And the question that I have, I hear you talking about the nursing homes, and I hear you talking about going to senior citizens. But what about the senior citizens that are in the city of Detroit, in neighborhoods who've been there that are 65 and over? How are they able to get the contact if they don't have people to take them to the testing, or they don't know how to get it, or they don't know how to access the website? Because it seems that when it started out, it wasn't just from the nursing homes and these senior apartments. It was everybody in the city coming from different families. So how would you know if you're asymptomatic and you still may have it in your home and don't know it, and then when you go out or you go out for your shopping or whatever, you may still come in contact or be able to pass it on. So it seems like you have a lot of seniors that still live in there on their own in residential areas. So how are you going to proceed to help those?
Great question. So again, focusing on communication and testing. So with communication, I know there may be seniors who don't have access to the internet. And so again, we've done a really good job, I believe, of putting ads on the radio. We have done phone campaigns where we're calling residents. We have spoken directly with City Council to provide those direct communication channels, lots of email. But I think what's really important is that we've made testing available to anyone who needs it, not just those who are above 65. Now, I believe it was 2 weeks ago, Mayor Duggan said those who are 60 and older can get testing for free, but now it's available to anyone. And if they don't have transportation, all they need to do is call the call center to schedule an appointment. That number again is 313-230-0505. They can say, look, I'm a senior, I don't have any transportation, and that's okay because we're going to pick them up. So that should not be a barrier. We're also talking to local clergy, and we've told them to tell your members they can come to Safe Grounds once they get their appointment to be tested. So I think we are utilizing multiple communication channels to make sure that everyone who wants to get tested can get tested. Thanks for the question.
Okay. Yeah, thank you, Denise. We're going to let you go.
Okay.
If anybody has any other questions, go on and put them on the chat box. And if Denise is not on, we'll make sure she gets the question, or we'll make sure it gets answered for you.
Thanks so much. And then
thank you.
So one more thing, if you guys, I know this is an incredible group, and I'm just so honored to be here. I know you have a lot of great ideas. And so if you can think of an innovative idea or something that we're not doing that we should be doing, send me an email. And my email is pretty straightforward. It's healthofficer@detroitmi.gov. Again, healthofficer@detroitmi.gov. I appreciate everyone on this call. And again, please share that message forward. All right,
Okay.
thanks so much.
And we appreciate you.
Yep, take care.
Thank you. Okay, perspectives from the field. Dr. Iris Taylor is going to kind of introduce that and lead us through that one. Iris? Iris? Well, I will begin.
I was talking and
Oh, there you are. Okay.
I was just
Okay.
talking and I was on mute. I apologize.
Oh, sorry. We do that
We have
sometimes.
our
No
partners
problem.
here with us this morning that are participating in our quality improvement project, Healthy Baby at Home. We have our MIHP partners. Deshauna Johnson, who is the MIHP coordinator and CEO of Mother's Friend. We have Vanessa Hall, who is the coordinator and CEO of All My Children. And we have with us Teresa Vinson, who is coordinator for Impact. Those are the three MIHPs who are working in our improvement opportunity. We also have with us today Gaylada Murray, coordinator for Wayne Home Visiting Local Leadership Group and Great Start Collaborative for Wayne. We have with us from Focus Group, Lakeisha Grant, who is the lead home-based teacher, and Jason Lasasso, who is the director of advocacy and equity at Focus Hope. So we will begin with Deshaun. We're asked that you put your questions in the chat box, and we will do the questions at the end of the three presentations. Good morning, Deshaun.
Good morning, Dr. Taylor, and good morning to everyone who's on this chat. My name is Deshaun Johnson. As Dr. Taylor stated, I am the nurse coordinator for Mother's Friend, which is an MIHP agency. We are currently serving the majority of our clients are in Wayne County. They're Wayne County residents. Our case flow at this time is about 350 clients, and that includes pregnant moms and babies. Our staff includes nurses, social workers, and a couple of administrative staff. Next slide. So far, we haven't had any clients that have tested positive. Clients have sheltered in place since the stay-at-home order, and homes that include children and other adults who are laid off are also sheltered in place. since the stay-at-home order. We've had several staff members that have been tested and they were found negative. Telehealth is being used by all of our staff at this point with our clients, and it's such a godsend. And we thank everyone who was part of getting this set up for MRHPs. Staff training and instructions were provided in order for our staff to use telehealth accurately. And then we really haven't had staff turnovers at this point because basically everyone is working from home, and that seems to be working for us. But I'm sure at some point we will probably have to increase our staff. Next slide. So for client referrals, we are still utilizing our partnership with Hutzel Hospital, and that's OBGYN prenatal clinic. And I thank Marcy and Dr. Taylor for that whole collaboration. I'm usually in clinic every Monday. So if providers need to talk to me or staff or something about a client that may be present in the clinic, I'm right there. We recently had a new electronic medical record system built for us. So that helps us keep track of our moms and babies. They're color coded so we don't get moms confused with babies. Our infant caseload is being generated by our pregnant moms that deliver. So once mom delivers, then we try to enroll baby as soon as possible. And as far as telehealth, why it's so successful, because at this point, clients don't really know what to expect, so they prefer you not to come into their house. Because they're hearing different conflicting information through social media and things like that. So far, they want us to continue to provide services, but they do fear about you going to someone else's house, then coming in their house, et cetera, et cetera. So right now, telehealth contact is what's desired by the clients. Some of our challenges have been, like I said, we're going to have to increase staff for the demand for our client contact. And another one of the challenges was delayed telehealth reimbursement from Medicaid and the managed health plans. But I want to thank again my SEMPQIC family for making that barrier being removed. It was removed immediately, and that was just like a godsend. And so that helped us to continue to provide services, and it helped all the other MRHPs that were experiencing the same thing. Next slide. Right now, client needs include finding food. It's like they go out to purchase food, but the shelves are empty because people who have better transportation, more financial resources, they can go and buy like bundles. They're gouging the shelves, and that's even with formula, diapers, household cleaning supplies. Like I'm still trying to find sanitation wipes for myself. So, and everyone doesn't have access to Amazon and being able to order that way. They have a fear using public transportation, especially when they saw what happened to the bus driver. And at one point, they hadn't set up the public transportation where it would be safe utilizing it, with the 6 feet and all that. I already touched base on infant formula not being available in some stores. Infant diaper sizes 1 to 2, I'm having a hard time finding those. I've been ordering them offline, and so far that's working, but it's getting down to the point where I'm having a really hard time finding sizes 1 and 2. Again, the price gouging, the diapers and the other items, it's an issue. Another issue we were having was when some of our clients were trying to get in contact with their DHS workers, they were not really responding to them. We had a major issue where one of our clients' gender was entered wrong, and the only way that could be fixed was through DHS. So I'm not sure if that's been resolved. Oh, I was just told it has been resolved, so I'm happy about that. And what I've been doing, again, like I've stated, I've been providing diapers, wipes, pack and plays, and car seats, because I understand some of those classes the girls can't make it to. I'm sure they're doing smaller sessions, but when my staff reach out and say, hey, she needs this, she's going to deliver next week or something, then I'm on the internet ordering as much as I can. But then again, they limit me as to like how many pack and plays and car seats I can order at once. Next slide. Some of the stressors our clients are facing is just living with the uncertainty of COVID-19 and when things are going to go back to normal. What will normal really look like for them? A lot of them are expressing concerns that when they go to deliver, they think their infant's going to come in contact with COVID-19 in the hospital. We're educating them and telling them that that is not the case at all. That's not a concern they should have. The hospital is taking every precaution known to make sure that they deliver safely and their infants safe. And then some of them have not been taking their older children to their well baby checks or well child checks and foregoing the immunizations. Like they don't want to do the normal immunizations that are recommended by the CDC guidelines that existed before COVID-19. So again, that's more areas of opportunity for teaching. And then we've had some pregnant women that were saying, well, I'm not real comfortable going to my prenatal appointments because of this and other. Again, we are reassuring them that the hospitals are safe, you know, and that they will not be contacting COVID-19 when they attend their prenatal appointments. And as far as our clients that are showing some signs of stress and maybe have a history of mental health disorders, that we're using telehealth counseling services and we're referring them to appropriate counseling individuals that we know that they will provide the services that they need. Next slide. Is that it? Yep.
That's it.
Yep, that was it.
I went through that faster than I thought.
We're gonna let you get your questions into the chat column. So we're gonna go now to Ms. Murray. Gaylada?
I'm here. I'm like you. I just I had to unmute. What I was going to say is to let you have the others talk as well, because the home visiting group, the home visiting local leadership group, is a coordinating body, and at our table we have several home visiting organizations, and so I really don't want to take away from anything they may say. I want to add to. So if you don't mind, if you could let Vanessa and the other go ahead of me.
Actually, they're going to participate in the question discussion answers.
Okay.
Go ahead.
Okay. So what I would say for our body, and we talked about this at our last meeting last week, I think it's going to be important for us to be able, us home visitors, to be able to get information. The information that Denise Fair shared was very good information about what they're doing, what's out there, what's available. But what I'm getting a sense from is that not all of our home visitors know about that and are not able to share as much of that information with their clients. Clients are saying that they don't know this and they don't know that, and it's a bit overwhelming for home visitors to be able to get accurate information. I'm not sure how we remedy that other than just make certain that maybe that information gets to me. I can share it with the membership. Bodies like SEMPQIC, share it with the membership. I just think it's important for that to happen. The other thing that I would add to what Deshana is saying is that some of my folks are saying that parents or pregnant women are hesitant to go to the hospital because they have heard that some believe that if you go to the hospital, you're definitely exposing yourself to the COVID virus. And so they are missing prenatal care appointments and are not going. And so we just need to do more to educate families about the importance of continuing to trust that the hospital is a safe place to go. And again, I don't have the answer for that, but I do know that it's obviously an issue that we need to address. Not certain what else I can add to that, but that's just some of the feedback that I've gotten from our folks, from the Home Visiting Local Leadership Group.
Thank you. And lastly, we have from Focus Hope, Lakeisha Grant, lead home-based teacher, and Jason Lasasso, director of advocacy and equity.
Hi, this is Lakeisha. I just want to, Jason, you there?
Yeah, this is Jason and Lakeisha.
Okay. Would you like for me to go first and then you next?
Is it better for me to just provide a brief overview of the organization and then you go into specifics?
Go ahead.
Okay. So, hi everybody. I'm Jason Larsosa, a direct advocacy and equity for Focus Hope, here with my partner Lakeisha Grant, who's a lead home-based service provider for Focus Hope. I think a lot of you are familiar with the services that Focus Hope provides, but I like to bring people back to the context of the organization. And I think that's particularly appropriate in the face of the disparities, the glaring disparities around COVID. So we were founded in 1968 as a response to the 67 unrest as an anti-racism and social justice organization. And our mission involved and continues to involve overcoming racism, poverty, and injustice in really practical and intelligent ways. We have been addressing COVID by attempting to ensure that the entire household, that the community, education, and economic goals of the household are not disrupted. And we're continuing services to the best of our ability to those that we regularly serve without exposing families unnecessarily to risks. So looking at our services to senior citizens, to working adults, to young people, and to children, the biggest service population is those senior citizens. We provide supplemental groceries, about $40 worth of groceries, to about 41,000 senior citizens every month. And there was a large portion of those people who would come into our facilities to receive those boxes. We have adjusted our services so that they just pull up in a parking lot and we pre-box those items and just drop them into their trunks and they can go on about their way. And all of our workforce and youth development programs have been moved online. We did that pretty seamlessly. And we've been serving additional families through our early learning program since our young people are not in school to try to supplement some of those essential items that would be provided to children if they were in our facilities. And I'm gonna let Keisha talk more about that.
And so as the home-based lead, every Tuesday and Thursday, we're providing diapers, formula, baby food at the Center for Children. So not only can our families who we service come on Tuesdays and Thursdays, the community is able to come on Tuesdays and Thursdays and receive diaper, wipes, baby food, formula. They'll just contact the center and they'll take their name and their number. So when they come, we'll just check it off that this family received what they requested. We also partner with Gleaners, and so twice out the month we offer food, and they can pull up and we'll put it inside their car just as well as we do for our diapers, wipes, and baby food. Our home-based team contacts families with children every week and just get an up-to-date overview of how their life is during COVID. We offer activities for them to do with their child and any resources that they may request at that time. If we don't have it on hand, we'll get some type of resource for them either within that day, send out a text and give them the resources that we found that they requested. Some of the resources families asked about is like tissue, paper towel, just household things that the local stores shelves are kind of empty, and they're now restocking, but in the beginning of the crisis, it was not a good look for our families, especially the families who didn't have transportation. So that was some of the issues that we were facing at that time. New issues are like the wheel baby checkup and not feeling like they want to go into the clinics and hospitals and things like that. However, I still encourage them to reach out to them and try to do Zooms with their doctors, and really try to get back comfortable with being able to communicate with their doctors a different way and letting the doctor say, hey, come on in, it's safe. And so put that back on the doctors. We also do socializations online. So we do similar to what we're doing now. We do with our families. It's 36 families. And they can get on the Zoom call and we can all see each other and talk and pass out resources that way. That gives the family opportunity to see other adults and still do social distancing. A barrier with that, some families do not have internet or do not have a phone that allows them to make downloads. They're able to call in, but we're just not able to see them. But they still have that opportunity to join in with the rest of the group. And so if I could think of something more I would like to do, it would be to, you know, have care package for the families who may be needing household supplies, masks, gloves, and things like that. Having those type of things able to be delivered to their front porch if they say we don't have disinfectant, things like that to keep their house clean, or, you know, hand sanitizer. Those are some things that I think I wish that we could drop off to families in their time of need. Other than that, that is what we've been doing at Focus Hope.
Thank you. Thank you. We have a few questions in the chat box. One question is, if a client wanted a home visit, would you go out in person? That'd be for any of the 3 MIHPs.
Well, this is Lakeisha. I'm not an MIHP, but right now, no, because we're practicing social distancing. So we try to use the Zoom and the telephone.
Deshauna or Vanessa or Teresa?
Yeah, this is
Yeah.
Tashana. If the client requested a home visit and we felt that it was safe and the client felt that it was safe, we would do the visit. Although we will be wearing personal protective equipment, we would also bring some additional in case the client didn't have any in their home. And we would also practice safe distancing. So as an example, you could do a home visit sitting on the porch and you talking through the screen door to the client and making sure you've got that 6 feet away. That way you're looking at her, you're talking directly to her, and she feels that personal visit.
Okay, another question is, well, Don gave us statistics that there are 88 pregnant women in Michigan who have tested positive. That was one of the questions, how many women? Okay, the answers to that. Okay, here's the question. Are diapers, wipes, and formula only available to those who are phones? If you aren't talking, that would be helpful.
Yeah, one more time. The question.
Diapers, wipes, or formulas to the MIHPs are only for those who are enrolled in the program.
So for Lakeisha at Focus Hope, we service the community. So the community can contact our front desk, put their name on the list, and they'll be serviced.
Yeah,
For
and
the
that's
other
regardless whether they're a current participant or not.
Say it again, Jason.
I was just building on what your response, Keisha, that's regardless to whether they're a current participant or not.
Yes.
Anybody can access.
For those that are enrolled in the MIHP program, that you have to be enrolled to receive services. Is that correct?
Yes, at this time. But if you're not one of our clients, then we're going to refer you to 211 or to the coordinator's directory for MIHP if you're pregnant or you have an infant that's eligible for MIHP.
Okay.
For
Here's
me,
a
I have.
says, as churches reopen, what are the plans for using them to boost the number of people who are tested? I think that's more for our previous speakers.
Think so,
Denise is
yeah.
on the phone.
I think Vanessa was trying to jump in with a response to that last question.
Okay, Vanessa, go ahead.
Hi, I was just saying that for clients that are not in the program, I still give them, if somebody calls me and they need some diapers or wipes, I have some donations, I will give it to them.
There was a question about if people wanted to donate diapers, where would they do that?
I can put my contact information inside the chat box. This is Lakeisha. I'm at Focus Hope because we do accept donations.
Okay.
I've also included, this is Deshauna from Mother's Friend. I've also included my contact information, and we'll go as far as to come pick it up from you so that you don't have to come to us. We'll come get it.
Okay. Teresa or Vanessa, did you have anything to add to that?
No, I accept donations as well.
I wanted to say that we have been, this is Teresa from Impact Community Health. Our social workers, they don't have a problem as long as the client agrees that they can come to their home. They have done conferences even from their car, and the lady in the door or the client in the doorway of her home to keep the social distancing. And as the other lady said, we will provide masks and things as they go. They'll take extra just in case they don't have it. Also, Dr. Taylor, at the end of this, I have a question for you because we were supposed to be in contact.
We'll get back. Okay.
Okay.
Let's finish the chat back questions first.
This is also actually Marie.
We're a little bit over our time. Go ahead. Who is this?
Hi, this is Marisa Rodriguez from Make Your Date. Just also chiming in, we're accepting donations also for pregnant women, and we can arrange pickup and drop off as well.
Very good, very good. Devin,
we'll be sure to get that information
out. Time. Is it possible, Devin, that we could copy these questions that are in the chat box and then respond back to individuals by listing answers on our webpage or some other manner of social?
Yep. Yeah, so I will have copies of all of the questions, and we'll have everybody answer them, and we can put them like in an email out to the group.
Okay, Vern, seeing that we've run over time.
Thank you.
Alethea, okay?
Okay, yeah, thanks, Iris. Before we move on for Focus Hope, if you were to have a flyer about the city of Detroit, the testing, some of the information we got from Denise, could you put that in the boxes when you take food home to seniors?
Vern, we can absolutely put those in the boxes. I didn't mention that we're currently putting census information every week in the boxes for the older adults.
Yeah, that'll be really one way to reach seniors that are at home with information about where they can go get tested and all that kind of stuff.
Absolutely.
So we'll follow up with you on that and connect you with Denise to be sure that that happens.
Okay.
Okay, this has been excellent. Could have been an hour. Lots of good information and questions, and we will get those responses, and we'll be sure they get out to everybody, to our network. Alethea?
Thanks, Vern.
You have a few minutes.
Okay, thanks a lot. Yeah, I'll shorten my piece. I think the information that we've heard so far really has been excellent, and just wanted to take a few short minutes to highlight how all of this relates to health equity and how what we do once we begin our preparation for reentry to the new normal or to the changed response to our residents might be considered. And, you know, we've already heard a lot of guidance from the speakers that have already spoke. I think Renee made it real clear that that health equity lens allows you to look at things to see where the power, poverty, and racism impact our decisions or our actions, that we responded to the pandemic by using multi-communication methods. We need to do that for all our services because people need to be able to know what is available and what can be provided. We heard Dr. Gibson Fountain talk about establishing a professional policy on implicit bias training for providers, as well as Denise and I think Jason even talked about the multi-generational status of the households. These are the same households of women that we're serving every day. And so recognizing that and keeping that in mind as we move forward will be important. That 24/7 hotline, call line that the city has available certainly can make other information available once we have a different focus from COVID-19. And then the partnerships, using medical students, that homeless shelter connection. The city knows all the homeless shelters that are that exist in Detroit. Certainly we can do that and continue to be in touch with those shelters. And then the rapid response to informational needs and maximizing telehealth, I see as being really, really important as we move forward. You can put up my slide, Devin. So, you know, COVID-19, as someone else mentioned, shines a light. I certainly agree. It was the spotlight to the inequities that already existed. As we move forward, let's make sure that we check our assumptions. Everyone doesn't have food. The needs that people have for food now existed before they became infected. It's certainly highlighted, but that was not a new need. Smartphones do exist in the households, but people have limited minutes. And so we have to keep that in mind moving forward, although we can maximize telehealth and help people feel safe and confident in using that as a way to connect with providers. PPE is a safeguard, but it may not be available equally. And so, you know, as we tell folks to wear a mask and use gloves, recognize that not everyone is going to be able to access them readily. I live in the city of Detroit. Where I live, you can buy 2 masks for $2.99. On another part of the city, they're selling those same 2 masks for $10. So, you know,
wow.
This is what our residents are experiencing.
Wow. Yeah.
Safe transportation isn't available. And so, you know, we have to keep that in mind, although there are alternatives that may be out there. And, you know, certainly moving forward, moving through this, I won't even say moving forward, but moving through this journey, we have to continue to act like we care. And our providers have really done that during this pandemic. But have we considered providing memorials for those that have passed on? And that can be done in many different ways. If you have a newsletter, if you have a website, you can even, you know, use handouts that people can write the name of their loved one and post them in your agency so that it's clear that we're connected to the community and we care about the community and we empathize with their loss. And I said, don't resume bad practices. That really should be ineffective practices. But I want to make it clear. Let's not go back to those things that didn't work.
Right.
Once we are past this, and then take action for change. And I'll end by leaving you with the quote that's here. I won't read it just because of time, but in some of my previous talks, you've probably seen this. I continue to use this quote from Dr. Martin Luther King, because we are all connected. What affects one directly affects all indirectly. And I think COVID shows that, magnifies that, that thought. So I'll end there and turn it back to you, Vern.
Thank you, Alethea. You really captured a lot of what we need to pull out of this meeting. It has been tremendously helpful, and rest assured, we will be following up on the recommendations. We will prepare another written statement to the committee. Last time we did a quick survey before we sent another letter. But if you have any thoughts now on what needs to be included in that letter to the Equity Committee, please send us an email. One thing that, in addition to the issues that Dr. Gibson brought up, one thing that we need to say is the inability of City of Detroit or at-risk clients to access their basic needs: paper towel, toilet paper, hand sanitizer. And there needs to be a better way to respond to that, because almost every speaker mentioned that there are places to give it out, but there's just not enough coming in any coordinated way. And I also just highlighted in my notes, we will definitely follow up with Focus Hope, who has an inroad to thousands of seniors who are at home, to be sure they have that information. I think we need to beef up our website a little bit. If we could get the hotline, and we will, number for each one of our counties in Region 10 and put that on our website. Now we have Detroit and Outwayne County. We need to put all the others on there too. And we've got a whole list of great resources just on the chat box. So we'll put that together and get that back out. Are there any announcements from anybody that's on the phone? We do have a few minutes left. Verbally, if you will, that would be fine. Okay, not hearing any comments from Iris or Alethea before we disconnect?
No, I think today's call was very rich in information, and really appreciate everyone's participation and all that attended.
Thank you, thank you. We see on the screen that the summit is now 22nd and 23rd. That's the Maternal Infant Health Summit. And our next meeting is going to be June the 30th, and it will be another virtual meeting. Okay, thank you to everyone, and enjoy the rest of your day, and you'll be hearing from us. Bye-bye.
Thank you, everybody.